Today, we are going to talk about one of the most important infections in critical care, ventilator-associated pneumonia, or VAP. This session will help us understand what VAP is, why it matters, and how we can prevent it through effective infection prevention and control practices in the ICU. Our goal is to strengthen patient safety and improve clinical outcomes by preventing hospital-acquired infections, also known as HCAI. Ventilator-associated pneumonia, or VAP, is a lung infection that develops in patients who have been on mechanical ventilation for more than 48 hours. It is one of the most common healthcare-associated infections found in intensive care units worldwide. VAP significantly increases morbidity, mortality, ICU stay, and hospital cost, making it a major concern for patient safety and infection control teams. VAP is not just another infection, it is one of the most frequent ICU-acquired infections, accounting for up to 25% of all hospital infections in intensive care settings. It is strongly associated with prolonged mechanical ventilation, often delaying recovery and extending ICU stay. Because of this, VAP often leads to overuse of antibiotics, which in turn increases the risk of antimicrobial resistance, a major global health concern. Ultimately, VAP has a direct impact on patient outcomes and hospital costs, which makes its prevention a top priority for all ICU teams. Now that we understand why VAP is such an important issue, let's look at the risk factors that make patients more vulnerable. The first and most significant factor is prolonged mechanical ventilation. The longer a patient stays on the ventilator, the higher the risk of developing pneumonia. Supine position, or lying flat, increases the chance of aspiration, allowing secretions to enter the lungs. Poor oral hygiene and inadequate hand hygiene also contribute to bacterial colonization and cross-infection. Aspiration of secretions from the oropharynx or stomach is another major cause. And finally, immunocompromised patients such as those with chronic illness, diabetes, or steroid use are especially at risk. Recognizing these factors helps us take early preventive actions. Now that we've identified the main risk factors, let's move on to how we can prevent VAP through strong infection prevention and control strategies. The first and most essential practice is strict hand hygiene, following the WHO's 5 moments for hand hygiene. This simple step greatly reduces cross-contamination. Next, always elevate the head of the bed between 30 and 45 degrees. This position prevents aspiration of gastric contents and helps maintain lung expansion. Perform daily sedation interruption and assess readiness for extubation. Reducing unnecessary sedation shortens the duration of mechanical ventilation. Provide oral care with chlorhexidine regularly to minimize bacterial colonization. Use endotracheal tubes with subglottic secretion drainage ports to remove secretions that accumulate above the cuff. Lastly, maintain closed suction systems and proper ventilator circuit management. Avoid unnecessary disconnections, as these increase infection risk. These evidence-based strategies are proven to lower VAP rates and improve ICU outcomes. Now let's put all those prevention measures together into what we call a VAP Prevention Bundle. A bundle means a set of evidence-based practices that are applied together to achieve better outcomes than when done separately. The main components include hand hygiene, to prevent cross-infection; head-of-bed elevation, to reduce aspiration risk; daily sedation interruption, to shorten ventilation time; oral care protocols, to minimize bacterial growth; and early weaning protocols, to remove the ventilator as soon as it's safe. When these measures are performed consistently as a bundle, compliance improves, and we can see a significant reduction in VAP rates, better patient safety, and improved clinical outcomes. In conclusion, ventilator-associated pneumonia is a major ICU-acquired infection, but the good news is it is highly preventable. By implementing infection prevention and control measures and following the VAP Prevention Bundle, we can significantly reduce the incidence of VAP. Continuous education, training, and monitoring are essential to ensure that all staff members remain compliant and consistent in practice. Most importantly, VAP prevention is not a one-person task. It requires a multidisciplinary effort from nurses, doctors, respiratory therapists, and infection control teams. Together, we can make VAP prevention a routine part of ICU culture, protecting our patients and improving the quality of critical care. Thank you all for your attention and participation. VAP prevention is not just a protocol, it's a culture of patient safety that we all build together in the ICU. Let's continue to stay committed, stay consistent, and protect every patient under our care. Thank you once again, and let's keep making a difference, one patient at a time.